Glad you're here watching my video on YouTube. The fact is, I don't know how long this will be up, since YouTube has decided to start censoring me and pulling down my videos. But don't worry, you can watch this video on rumble.com/randpaul, where I post all of my content. Love to see you over at rumble.com.
Good to see you. Joining us now is Kentucky Senator Rand Paul. Great to have you with us, Senator.
Thanks for having me.
All right, so same as it ever was, how can we expect the federal government to develop a long-term plan for anything, COVID or infrastructure or anything, when they seem to run out of money every 2 months or so?
Well, see, here's the thing. They've known the date would come this Friday for the last 2 months. You would think they would do a little bit of planning. If you want to pass something in the Senate, it takes about a week to pass something unless you do it unanimously. And there is contention, there is differences of opinions. I, for one, do think that it's very important that we debate whether or not the funding should include funds for mandating that people be vaccinated or that they be fired. I think that's a terrible thing to do, and we shouldn't do it. We should at least have that debate. I don't want to shut down government, but really the reason government would shut down is Democrats would deny debate over the vaccine mandate and deny an amendment vote. I'm being told that the amendment vote is tricky because the Democrats are afraid we will win. It's a simple majority, and they think all 50 Democrats, all 50 Republicans, and 1 or 2 Democrats may vote with us not to fund the mandates, so they're going to try to prevent the debate over a mandate, over the vaccine mandates. But to do so, they're the ones that shut government down, so it's sort of a matter of perspective, who's shutting government down. But the bottom line is Democrats have the ability to do whatever they want. They're in the majority, but they have to plan. They haven't planned for this, but they also haven't planned for raising the debt ceiling. We're going to have another problem in 2 weeks. They're going to come to the last day and say, oh, Republicans won't let us do it. But it's really a lack of planning. It's incompetence on the part of Chuck Schumer that he can't get this stuff done in a timely fashion.
I mean, the last time I checked, Senator, Democrats control the Senate, they control the House, they also control the White House. And it's kind of amazing to hear Chuck Schumer try to pin this on Republicans. And also, I think it's frustrating for a lot of Republicans, too, to not hear what you just said more often from other Republicans, that, look, we are not the ones to blame here. Democrats control the whole entire process. We're just trying to prevent an unconstitutional mandate.
Republicans can bring no bill to the Senate floor. It's completely controlled by Democrats, completely controlled by Chuck Schumer, and he didn't plan very well. If he really wanted to plan this spending bill, he should have started last Friday, and he could have easily passed it by this Friday without any Republican support. But now to get it passed in a shortened period of time, he needs Republican support. I, for one, don't support all the increased spending. I think we should be cutting spending, not expanding spending. I, for one, don't think we should have any money in there for a mandate, and I think it's worth having the fight. I don't want to shut down government. I actually have a bill called the Shutdown Prevention Bill that would say, yeah, government stays open, but at a reduced rate, and every 90 days it goes down another percentage point if you don't come to an agreement. That would force us to have agreements, but they don't want that.
This is the fakest fight, and I think, you know, Americans who hear about it that aren't in Washington, D.C., their eyes glaze over because they know this is all just posturing, it's all fake, and it could all easily be prevented. You know, something else I want to talk to you about as well is this H.R. 550, also known as the Immunization Infrastructure Modernization Act. It would give $400 million, and it would expand the power of the CDC to gather data from public health departments. That sounds pretty scary to me.
You think if we give the government $400 million more that Dr. Fauci will all of a sudden start paying attention to natural immunity, deciding and studying how much of an effect natural immunity has in overcoming this virus? No, they're not even counting it at all. So giving them $400 million to continue to ignore natural immunity would be just throwing money away. You might as well burn it in a pile as to give it to Tony Fauci.
Yeah, there were a lot of Republicans that seemed to support that as well, but I know you do not. I'll leave that there. And I also want to talk to you about some of the stuff we see happening around the world and why it is so important that we stand up for our constitutional rights that we have uniquely here in this country. You know, we've talked about Australia before. There were 3 teenagers who were arrested after they left a concentration camp, a COVID concentration camp. So we've heard about that. Also now Greece is making people over 60 pay a fine if they don't get vaccinated. And if we don't stand up for liberty and our freedom here, our medical autonomy, this is what could happen in this country.
And realize it's all based on a big lie. The big lie is that people are not getting vaccinated. 99.9% of people age 50 to 64 have gotten vaccinated. No, 64 to 75 have been vaccinated. Over age 75, 97% of people. Over age 50 to 64, 87%. The real truth of this is the vaccine has been overwhelmingly popular, and the vast majority of people at risk for this disease have been vaccinated. So we don't need a mandate on people. People are choosing to be vaccinated, and that's a good thing. But the mandate is simply to condition us to submit to the state, to submit to one authority, one man who believes his science. And if you let them win on this, it'll never end. They will never let go of us. They will never let go of our health care. They will command everything we do, every day, every medicine we take. We cannot let them have this much of power accumulate in the hands of one person.
I don't know about you too, but to me it also seems like we're not getting the full story on this Omicron variant. They're pressing the panic button, but we don't have really the data to back that up. At the same time, you know, to come to this country, you have to get a PCR test, as far as I understand, to get here. And the person, the first case, this guy was vaccinated, double vaccinated, in fact, and maybe they had to take a test to come back in this country. And so that shows us that the testing might not work here. The vaccines obviously aren't working to prevent at least the contraction of this new variant here. So what are we doing, Senator? I mean, what is the strategy here to actually combat this?
You know, I think it's premature to do anything if we don't know yet whether this variant is going to be more deadly or less deadly. If it's more deadly, I'm open to a discussion on things we need to do, but the things we do need to have an effect or change the trajectory of the virus. I personally don't think that bans, countrywide bans on travel, have done anything. I don't think the bans in the previous administration worked or in this administration. It's already here. It's already going to be found to be throughout the United States, whether you ban, and they're not willing to ban anybody coming across the border illegally, so that means they really don't care about this at all.
Yeah.
But it'll be a great destruction of tourism and travel if you put more requirements on it. People like me are going to say the heck with it. I'm not going to submit to all your pokings and proddings in order just to travel.
Yeah, you're one of the people that seems to understand this. If you make the restrictions too onerous, people are just going to find a way around them. I mean, that's human nature. We see that anyway. Senator Paul, great to see you. Thanks for the conversation. Hope to talk to you soon.
Thank you.